Welcome to this episode of X-Connect Northwest. I'm your host, Greg Mills. The winter months are upon us, and with it, there are several health-related concerns of which the community should be aware. Today, we're joined by Dr. Dennis Garcia, Medical Director of Health and Wellness Services at WSU. Before we get going, a reminder, you at home can chime in with your questions simply by connecting with us on Twitter, Facebook, even right here on our live stream. Dr. Garcia, great to have you here.
Yeah, thanks for having me back. It's good to be here.
And I was going to say, great to have you back again, and it's always a pleasure to have you here. Dr. Garcia, let's start with what you do at Health and Wellness. What part do you play?
So I play several roles. One, I'm the medical director, so I kind of make sure the organization continues to function and operate properly like it's supposed to for a healthcare clinic. And I'm also one of the staff physicians, so I see patients on a daily basis and just help keep the campus community healthy.
You know, we were talking a little bit before we got started just about how many students come through there every day, or how many patients come through every day, and it was a larger number than I thought. You were saying in the hundreds, right?
Yeah, we're a busy clinic. We're probably one of the busiest clinics on the Palouse, and see roughly 200 to 250 patients a day through our organization.
Yeah, and I under-guessed on how many physicians were there as well. You've got quite a few people working.
Right, a lot of people don't realize that we have 9 physicians, 4 mid-levels like nurse practitioners, physician's assistants, and we're the only AAA HC accredited organization on the Palouse. So we're proud of that.
And yeah, well, and it sounds like you're staying very, very busy this fall.
We are. This freshman class, and probably most of the sophomores too, have been sick a fair amount and see a lot of head colds and pink eye and sore throats and the usual things you get into when you're in close quarters with each other.
Well, and on that note, what sorts of things are we looking out for this winter?
Well, the usual, the influenza is always a big thing. And for those people that have a lot of experience with influenza, they might remember that it tends to be a late winter infection, but over the past 7-8 years, it's definitely migrated across the calendar and can show up as early as August, like it did in 2009. So we like to keep an eye out for influenza right away. The usual strep throat, mononucleosis a little bit more this year than what we're used to seeing.
Interesting. With the flu potentially coming in a little early, is that something you can predict at all with, I don't know, weather patterns and the way the flu's traveling around the globe, or how many things play into that? So
many things, and again, our world now is very mobile, and people travel from all over the world many different times throughout the year. So influenza now is starting to become, I think, a year-round problem where it didn't used to be. And like I said, we're seeing it mostly in the fall now, by October, November. Is when we're starting to see it, and it'll last all the way up until May, with scattered cases still in the summer. So it's gotten difficult to predict because we saw 3 cases early on at the beginning of this semester, and then that was it, nothing for like a month. And so we thought we were going to have a pretty bad season, but it hasn't turned out to be very bad yet.
I suppose there's still time.
Oh, yeah. There is.
Well, the winter months mean changes in a lot of things. In just what we wear and what we eat, and with diet and exercise together, what are we looking at as far as varying our diet for the winter months? Do we change up on that?
Yeah, unfortunately we're forced to, because we don't have our gardens, we don't have the fresh fruits and vegetables like we normally do. So we do vary our diets a fair amount. I think the most important thing is continuing to try to find those products if you can, and fruits and vegetables do make a good part of our preventative medicine for our immune system. Trying to still eat healthy, not too many comfort foods. Keep it light still, keep exercising. Exercising boosts your immune system, and staying out of crowds seems to be the big thing.
Oh, okay. Yeah. And by varying it, I suppose, as you said, staying away from the comfort foods thing, do you feel like we need to work a little bit harder at getting to the grocery store and finding those foods that are good for us because it's just a little bit more difficult? Is that what you're saying?
Yeah, definitely. Like for example, this time of year, you probably won't find blueberries in the grocery store, which is a good thing for you. However, if you do find blueberries, they probably traveled a very long way to get here, like from South America or Central America. And if you think about it, there's a kind of an anti-green effect there if you're paying a lot for your produce and it's being shipped in from other places, you're contributing to that carbon footprint.
Sure, sure.
So it's a catch-22. Frozen's better than nothing.
Mm-hmm.
So I do encourage people to still pursue fruits and vegetables, even if they're not fresh.
What about the exercise end of things? Obviously, wintertime, we just don't have as many outdoor activities available to us. Some people get out, but a lot of people don't.
Right, you have to be careful because, again, if your stability or your strength isn't that good and you're out in the wet or cold or ice, you can slip and fall and hurt yourself. So you do want to try and find things that you can do indoors. A stationary bike is always good. Doing, calisthenics, boring stuff, chair exercises, I tell the older people. Just you can do those things inside, and a lot of students have like videos of Zumba and other sorts of exercise programs that they can put on their laptop or their television and do those things in the winter. And staying active is real important because it does keep your immune system at its best.
And I imagine there's a little more difficulty getting on the bike at the gym this time of year, just because you're not able to get outside as much.
Correct, yeah, and going to the gym, there's more people there now because
Absolutely.
the people who prefer to bike outdoors are now indoors, and so you have to time it accordingly and have an alternative plan. And getting plenty of sleep. Trying not to burn it at both ends, because if you're sleep deprived, that also tends to compromise your health.
Do people tend to sleep more during the wintertime, or is it just a perceived thing?
No, I think they do. And as you've noticed, ever since daylight savings time, it's getting dark around 4:30, and
I have noticed.
it was 7:30. It just seems like a few weeks ago.
I know it seems to happen quickly, but it doesn't.
So all of a sudden, you start feeling sleepy much earlier than you used to, and so I do think people sleep a little bit more.
So what do we do to combat that so that we're not just coming home and just plopping down on the couch and just maybe consuming television or games or something like that, and making sure we stay active?
Yeah, try to maintain your same schedule. If you do go to the gym after work, still go to the gym. If you take your dog for a walk, still take your dog for a walk. Just bundle up and be dressed appropriately. And some people get lighting for their house. They do full spectrum lighting. Buy these bulbs that mimic the sun, kind of stimulates your brain and makes you feel like the sun is still out. And those things make a difference and kind of keep you alert until it's time to go to bed.
Have you ever tried that?
Personally, no, but I do recommend that a lot. And we do actually have a lamp like that at the Student Health Center that we allow the students to use.
Get a little vitamin D indoors.
We call it our happy lamp. Yes.
Let's talk about smoking. Certainly culturally, smoking has changed in the United States in the last 10, 15 years at least. It's even changing more potentially on campus and in our community as fewer and fewer places have it as an option near buildings or certainly in buildings anymore. What have you seen as far as smoking is concerned in the community that you deal with?
Yeah, so unfortunately, I hate to admit it, but I've been here 18 years. And over the years, I've seen, when I first arrived on campus, I was really concerned about the amount of students I saw walking around campus with cigarettes. You don't see that as much anymore. They're few and far between now. And so I think the trend has definitely gone away from smoking, which is a good thing. A lot of our international students still like to smoke. It's quite prevalent among the Asian and the Middle Eastern culture. But they're starting to get the message also that when they get here, it's really not good for you. You shouldn't do it. And there's a reason it says on that package that this can cause cancer, because it really can. And so that's improving a lot.
Yeah. I mean, overall, nationally, it definitely has gone down.
Correct.
I know. I very recently heard a statistic that said that actual tobacco cigarette sales had bumped up just a little bit.
Right. Those who smoke more.
Is that
Yeah. But not more people are smoking.
Okay, yeah, and that's where that statistic is sort of fashioned to meet whatever the criteria was of the question, I
Yeah,
guess.
plus the cigarette companies have been taking a hit for advertising to youth, and that's really not acceptable anymore.
And you have seen, as you said, a decrease in the WSU community and the student community, as you mentioned.
Oh, definitely, without a doubt. There's not nearly as many smokers as there used to be when we first arrived on campus.
Is there a lot of information coming from your office or offices around the university that still talks to that?
Yes, there is. Part of our intake for every patient that comes to the clinic, they're asked if they smoke.
Yeah.
And if they do say yes, they're asked what they smoke and how much they smoke. And so it's a prompted question every encounter. And if they answer yes, then we intervene, whether they're there for a sprained ankle or whatever. We talk to them and see if they are interested in quitting. So we're real proactive about trying to help our patients stop.
How about alcohol on the college campus? The two, sometimes at least in thought, go hand in hand.
Yeah, alcohol use seems to be maybe a little bit better, but not a whole lot. And there's several issues around that on campus. And we have another process that we're working on, and it's called social norms marketing, and trying to identify, help students identify who might have drinking problems or drink excessively or carelessly. And we have a little survey they have to do when they're new to our clinic. And if they score above a certain number, we have what we call an intervention and do some motivational interviewing to try to get them to realize that that's high risk. And if they need help with it, we're happy to help them.
Do you feel like you've had success?
Oh, absolutely. Yeah, we've pointed things out to them when they weren't there for that reason.
Right.
But they end up having to talk about it, or at least we prompt them. We don't force anybody to do anything, but we'll say, hey, you scored a little high on this. Be a little careful. We don't want you getting hurt.
Mm-hmm.
We don't want you graduating with your degree in alcoholism.
Do you see alcohol consumption increasing over the winter months or not?
I can't say that I do.
Stays pretty even across the...
Yeah, it seems to be pretty consistent
semesters,
based on what sort of social activities are going on campus.
And drinking-related injuries, is there a way to keep those down?
Yeah, that's a tough one, because already this semester we've had several people fall from heights and off of balconies and fire escapes.
Yeah, and incredibly scary news whenever you hear that's happened.
Yeah, I mean, people die from those things, and those are always scary. And last year we had a student at the University of Idaho freeze to death because he was intoxicated and didn't make it out of the cold. And
I recall that.
so those are very sad, and fortunately, I always say cougs take care of cougs. And when we see somebody in trouble, we usually try to help them before they end up in dire straits.
Yeah, I know many students are early to experimenting with alcohol, and moderation is often talked about as far in drinking terms, of course, as being something that can be healthy for you. Is that true?
That's true. We always preach moderation. The thing we caution people against is participating in drinking games.
Yeah.
If you're going to participate in a drinking game, okay, but make it beer, not hard alcohol, because you can get behind the 8-ball on the hard alcohol and end up severely impaired. But beer tends not to do that to you.
Yeah.
So if you're going to participate, at least choose beer.
All right. Just a short time left, but let's talk a little bit about fighting sickness this winter. What are some of the things we can do?
Okay, number one key is wash your hands. And you hear that from the time you're in kindergarten. And the elementary school kids take hand washing breaks. And we say the same thing here. After every class, wash your hands. There's students who sat in that same desk, walked through that same door, turned that same doorknob, and you just contaminated yourself with the 100 other people that just touched that doorknob. So wash your hands between every class. Before your meals, keep your pens and pencils out of your mouth.
Sure.
And don't share anything with anybody.
And immunizations?
Absolutely. Still, the influenza immunization is the most important. None of us can afford to miss a week or two of school, and that's what the flu can do for you. So get your flu shot. Get your meningitis shot. There's 2 meningitises now. There's an A and a B. And all of us have had sort of the first one. I shouldn't really call it A because it's a multiple of different strains, but now there's a B that's unique. And those can save your life. And that one's relatively new this past summer, so not all of us have had that vaccination.
Are students at higher risk, or is that across the board with the age groups?
Students are much higher risk because of the condensed living. So the high-risk students are those that live in the dorms, residential halls, Greek halls, high-density living situations.
Dr.
And
Garcia,
smokers.
Thank you so much.
Oh, you're welcome.
So great to have you here always. Look forward to speaking with you again.
Thank you, Greg.
All right. Thanks a lot. Thanks for joining us today at home as well and helping us out. Hope you enjoyed today's show. Remember, you can stay connected with us all week long by tweeting us, liking us on Facebook. You can add us to your circle on Google+, or email us at kwsutv@wsu.edu and send us those show ideas as well. If you missed any part of today's show, we'll have it online at nwptv.org. Thanks for watching. I'm Greg Mills. We'll see you next week on air and online.